Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Transvaginal-tape-bladder-sling surgery. Introduction. Urinary incontinence occurs when a woman cannot control the emptying of her urinary bladder, resulting in symptoms ranging from mild leaking to uncontrollable wetting. Urinary incontinence is a very common condition that can affect patients of any age, though it more frequently occurs in older individuals. 1 in 25 Americans and at least 1 in 10 people age 65 or older suffers from incontinence. A transvaginal tape or TVT procedure is a safe surgical intervention performed to help women regain bladder control. This patient education tutorial explains how the urinary bladder works and discusses the causes and symptoms of incontinence. The tutorial also explains the TVT operation and reviews its possible risks and complications. Anatomy. The human body has 2 kidneys. The kidney's primary functions are to continuously filter blood and produce urine. After the kidneys have produced urine, the urine travels from the kidneys to the bladder through 2 tubes called ureters. The bladder then stores the urine until you are ready to urinate. When you urinate, urine travels out of your body through a tube called the urethra. Incontinence. When the bladder is empty, the muscles in its wall relax. As the bladder fills with urine, it grows, and another set of muscles, called sphincters, automatically clamp down around the urethra to keep it closed and prevent urine from leaking. There are 2 groups of sphincter muscles: internal sphincters located at the base of the bladder and external sphincters located further down the urethra. When your bladder is full, a signal is transmitted to your brain telling you that you need to urinate. When you are ready to urinate, you do so by purposely relaxing your sphincter muscles and contracting your bladder muscles, allowing urine to pass through your urethra. When your bladder is empty, your bladder muscles relax and your sphincter muscles become tight again. The flow of urine stops, and your bladder is ready to be filled again. In women, the bladder and the urethra lie in front of the vagina and the uterus. Urinary incontinence occurs when a woman is unable to control the flow of urine, causing her to urinate involuntarily. There are a number of causes for incontinence. The TVT operation is recommended for women with stress incontinence. We will therefore only review stress incontinence in this tutorial. Stress incontinence occurs when urine flows out of the body uncontrollably when a person bears down, for example when a person coughs, sneezes, or lifts heavy objects. When a person bears down, pressure is exerted on the bladder, which pushes urine through the urethra. With stress incontinence, the sphincters, including the muscles around the urethra and the pelvic muscles, are weak and are unable to clamp down on the urethra. When the urethra is unable to stop the urine, some urine leaks out. Potential causes of stress incontinence include 1. Pelvic surgery, which can lead to weakness of the pelvic muscles and sphincters. 2. Childbirth, which can cause the pelvic muscles to weaken. 3. Intrinsic sphincter deficiency. With intrinsic sphincter deficiency, the sphincters are unable to keep the bladder outflow shut. Drinking a lot of caffeine or alcoholic beverages may worsen incontinence. If it is not treated, incontinence can result in serious health problems, including skin rashes and ulceration. Incontinence can also lead to loneliness, since incontinence sufferers are often too embarrassed to socialize. Consequently, it is very important to tell your doctor about incontinence early on. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Diagnosis. Most people who have incontinence are aware of the problem. However, it is critical to accurately diagnose which type of incontinence you have in order to determine proper treatment options. Urologists and gynecologists are doctors trained in diagnosing and treating incontinence. A urologist deals with diseases of the urinary and genital systems. A gynecologist specializes in women's health issues. To diagnose urinary incontinence, the doctor will first take a detailed medical history. Therefore, it is very important to know when incontinence happens and in which circumstances. The doctor will need to know about your past medical events, such as surgeries, pregnancies, deliveries, and medical problems. He or she will also require a list of all the medications you are taking. The doctor will then perform a detailed examination, checking to make sure that the muscles of the pelvis are not weak. A full pelvic exam may be necessary. You may also undergo blood and urine testing to ensure that you do not have a urinary tract infection or other infections. The doctor may also perform specialized tests to check the function of the bladder. These tests may include inserting a catheter in the bladder to measure internal pressures and to check for urine left in the bladder after urination. Ultrasounds and CAT scans of the kidneys and pelvis are also sometimes performed. Today, there are more treatments for urinary incontinence than ever before. The choice of treatment depends on the type of bladder control problem you have, how serious the problem is, and what treatment best fits your lifestyle. When possible, doctors usually recommend the simplest and safest treatments first. Alternative treatments. Bladder control training. Your doctor may suggest that you try to gain control of your bladder through training. With bladder training, you can change how your bladder stores and empties urine. The following are 3 ways to train a patient to control the bladder. Pelvic muscle exercises, also called Kegel exercises. Biofeedback. Timed voiding. Pelvic muscle exercises, or Kegel exercises, are easy exercises designed to strengthen the muscles you use to stop urinating. Strengthening these muscles, called pelvic floor muscles, helps you hold urine in your bladder longer, lessening or eliminating stress and urge incontinence. Doctors often suggest that you squeeze and hold your pelvic floor muscles for a certain count, then relax them. You repeat this exercise a number of times, usually several times a day. Your doctor will give you exact instructions. Biofeedback helps you become more aware of the signals you receive from your body. This may help you regain control over the muscles in your bladder and urethra. Biofeedback can also be used to help teach pelvic muscle exercises. Timed voiding and bladder training can also help you better control your bladder. In timed voiding, you keep a chart of urination and leaking to determine your patterns. Your knowledge of your patterns can help you plan to empty your bladder before leaking occurs. When combined with biofeedback and pelvic muscle exercises, timed voiding may help you control urge and overflow incontinence. During bladder control training, you may use a special absorbent underclothing that is available at most stores. The underclothing is not bulky and can be worn easily under everyday clothes. Management and treatment. Besides bladder control training, there are several other ways to help manage incontinence. Doctors may suggest a small throwaway patch, a small tampon-like urethral plug, or a vaginal insert called a pessary for women with stress incontinence. Medicines can also be prescribed to treat incontinence. Some drugs prevent unwanted bladder contractions. Some relax muscles, helping the bladder to completely empty during urination. Others tighten muscles in the bladder and urethra to reduce leakage. Drugs can sometimes cause side effects, such as dry mouth, eye problems, or urine buildup. For postmenopausal women, vaginal estrogen may be helpful. You should talk with your doctor about the benefits and side effects of using any medicine for an extended period of time. A doctor can also inject an implant into the area around the urethra. The implant adds bulk, helping to close the urethra to reduce stress incontinence. Injections may have to be repeated after a while because the body slowly gets rid of the implanted substance. While your doctor may want to first consider simple, non-surgical treatments like those described above, surgery is a very successful method for managing stress incontinence. TVT Sling Surgery Procedure. The TVT Sling Surgery can be done under local anesthesia, spinal, epidural, or general anesthesia, depending on the surgeon's preference and experience. The procedure involves the insertion of a sling in the lower abdomen under the urethra. The sling works to lift the urethra and prevent urine leakage. After the patient has been anesthetized, the surgeon makes a small incision between the opening of the urethra and the vagina. Using special needles attached to a synthetic sling, the surgeon passes the sling under the urethra and to each side of the lower abdomen. If the patient is awake during the procedure, she is asked to cough to make sure that the sling is helping. If persistent urine leakage is still evident, the doctor may tighten the sling until the leakage stops. The sling is then cut at skin level on either side of the lower abdomen, and the 3 small incisions are closed. Most patients go home the day of the operation. Risks and complications. The TVT procedure is very successful and safe. However, you should be aware of the possible risks and complications that may occur. If you experience any complications, you should alert your doctor and address the problem promptly. Risks of general anesthesia include nausea, vomiting, urinary retention, cut lips, chipped teeth, sore throat, and headache. More serious risks of general anesthesia include heart attacks, strokes, and pneumonia. Your anesthesiologist will discuss these risks with you and ask you if you are allergic to certain medications. Other risks common to any surgical procedure include infection, bleeding, or scarring. Infections are rare, but if they do occur, another operation may be required to remove the sling and clean the infected area. Bleeding, while possible, is also extremely rare. If it happens, it may require a blood transfusion. Scarring is also a risk associated with surgical procedures. Because the incisions for the TVT procedure are very small, scarring is generally not a big concern. Complications specific to the TVT procedure include injury to the vagina, uterus, urethra, bladder, or other pelvic organs. Such injuries are very rare, and your surgeon is well prepared to handle these risks.
The sling could wear down or cause damage to healthy tissue over time. This may require another operation. In extremely rare cases, a connection, also known as a fistula, may develop between the urethra and the vagina, and urine may start passing through the vagina. This complication may make another operation necessary to close the connection. If you notice any urine coming from the vagina, contact your doctor. The TVT operation may not help alleviate the symptoms of stress incontinence, and another operation may be necessary. If the operation restricts the flow of urine too much, another surgical procedure may be required to loosen the sling. It is normal for patients to have some problems voiding soon after the surgery. This issue is usually treated with the temporary placement of a bladder catheter. After the removal of the catheter, most women are able to empty their bladders more successfully. The vagina could shift out of its normal position and press on other organs. This may require further treatment. Make sure to discuss the possibility of future pregnancies with your healthcare provider if you decide to go ahead with the operation.
After the procedure. When you go home, you will need to walk several times a day to prevent blood clots from developing in your legs. When you sit down, try to prop your legs on a stool to keep blood from pooling in your legs. To allow your body to heal, you should not do the following until your follow-up appointment. No heavy lifting. Do not lift anything more than 10 pounds. No heavy housework. No driving. No sex. No work. Your incisions may be closed in one of many fashions. If they are closed with staples or stitches, the incisions should be kept dry until the staples or stitches are removed, usually within 7 to 10 days. Call your doctor or nurse if your incisions become red, hot, or swollen, or if you have any drainage. Your temperature exceeds 101 degrees Fahrenheit. You have any severe leg pain, swelling, or chest pain. These may be signs of potentially deadly blood clots. Any persistent nausea or vomiting. Severe pain. You should also call your doctor if you are unable to empty your bladder. You have pain when you urinate. Your urine has a foul smell. You have a foul-smelling vaginal discharge. You are passing urine through your vagina.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Today, there are more treatments for urinary incontinence than ever before. The choice of treatment depends on the type of bladder control problem you have, how serious the problem is, and what treatment best fits your lifestyle.
TVT surgery is a very safe and effective way to treat stress incontinence.
The TVT surgery can be done under local, spinal, epidural, or general anesthesia. A sling is inserted under the urethra to lift the urethra and prevent urine leakage.
As you have seen, there are potential risks and complications associated with the TVT procedure, but they are not likely. Your knowledge of these risks and complications will help you detect them and treat them early if they occur.
If you experience any complications, you should alert your doctor and address the problem promptly. While your doctor may want to first consider simple, non-surgical treatments like those described above, surgery is a very successful method for managing stress incontinence. Thank you for using Explain.